Hello, I'm Kirill Osipov, a manual therapist, sports medicine doctor, and physical therapist at Dynamica Clinic. Today I want to show you exercises that you can do for a herniated disc after you have had a magnetic resonance imaging. And on the control magnetic resonance imaging we see the formed ridge. And this tells us that your spine is sturdy enough for therapeutic exercises. If at the first stage you could mostly only do areas near your body and walk, then here we can already directly strengthen the lumbar part of the spine. The exercise with which I recommend beginning the recovery stage of disc herniation treatment, or more precisely, the direct strengthening of the vertebrae. To ensure that the history with herniation doesn't repeat, I recommend starting with a variation of an exercise called the dead bug. To do this, lie on your back. I sincerely recommend all of my patients to lie on their side. Next, as a whole, we turn onto our back and proceed to perform the exercise. That is, we give the lumbar part a break. We press the lumbar part directly into the floor and wait for 40 seconds. We push hard enough. You can extend your hands to feel this pressure as much as possible. For 40 seconds, we learn to breathe and maintain this state as an endurance exercise. When this becomes easy, you can do it. Make it a bit more complicated. For this, we will gradually lift our legs. That is, we maintain and support this pressure and slowly start to lift one leg and then the other leg. All these movements should be absolutely painless. The point is not how many times to lift the leg, but specifically to maintain the lumbar portion of the spine pressed to the floor as needed. If this is already going well, you can make it more complicated. We raise our hands to the ceiling, hold our hands in that position and continue to lift our legs. If we want to make it even more complicated, then we can lift the leg and place it just a little further away. At this key moment, there will be a condition to compress the waistline. That is, the waistline should not break in the bend. As soon as this happens, you can try to do a more complex version. Raise your toes, squeeze your lower waist, and start to straighten your legs one by one. Once again, I emphasize the importance to always keep the pressure in the lower back so there is no curvature. The more you straighten your leg, the more the back will want to bend. If you can't manage it, then you need to stick with the previous stage to make sure that the surrounding spine muscles are sufficiently strengthened. You successfully completed a more intricate version. The exercise as a variation of bench press, or the exercise from the big three of Mangila. It's a twist. One leg is bent, lower back is pressed to the floor, hands folded on the chest, and we begin to lift up like this slowly. We do 3 sets of 10 repetitions for each leg, then we change the leg again. It's very important to remember that these exercises can only be done when almost all the pain is gone. If they are not given to the leg, they may only remain insignificantly in the lower back. Well, generally it is better to start this stage after consulting a doctor. As an advanced version of this exercise, you can try to do it with both knees bent, hands clasped on the chest, pressing your lower back down and starting to slightly lift the upper part of your torso without allowing your lower back to pull away. A pulling sensation during this exercise is normal and indicates its suitability for you. And we try to do it not quickly, smoothly as it should be. Shaking will not be so bad. More importantly, it should not occur during the exercise, not afterwards. The next exercise is a side plank. It is also part of the big three McGill's exercises. When we get into the side plank, we do a simplified version with the knee. The key point here will be your body position, your shoulder joint, hip joint, knee joint, and ear should all be on one line. And then we rise. That is the most common mistake I see, is that people turn their hips back. So we leveled off, looked, here we lie flat and rise and hold. 2 approaches for 40 seconds each. If this is too easy for you, but I still recommend to go like along the rung, step by step. Don't immediately attempt the most challenging variation. The goal is to properly engage the muscles. Gradually build up their strength. Therefore, if you are already strong enough and have hung on one stage, let's say somewhere for a couple of weeks, you can move on to the next. Don't count on doing this in a week. We lift up, lift the leg, lift the arm, straighten the leg. These are all variations of the complexity. This version is one of the most difficult. We do 2 approaches for 40 seconds each to better engage the middle gluteal muscles. I suggest doing it like this. Line your legs up, got up, lifted your top leg, straightened it out. If we hold it like this, the front of the thigh will work more. If we lift from the heel, the middle gluteal muscle will load well. Another good exercise in the early rehabilitation period, when we no longer have strong pain, no shooting pain in the leg, some minor lower back pain may persist. This will be an exercise on pulling the rubber towards ourselves. We take a rubber band and start pulling it towards ourselves. Here we will have a key moment. We should, with a straight back, lean over, grab the rubber band, pull it slightly towards ourselves, and start bending our elbows, pulling the rubber towards ourselves. Do this slowly and smoothly. During this, strain the lower back and press, avoiding any unwanted movements in those areas. We repeat the 3 approaches 20 times. Also, a good exercise will be an exercise on the front surface of the thigh. You need to take an elastic ring, sit on a high stool or on a kitchen counter and do leg straightening. We keep the spine straight during this slightly tensed press and lift the leg. We make 3 approaches of 20 repetitions for each leg. Adjust the weight of the band in such a way that 20 repetitions would be sufficiently difficult. Also, in order to ultimately have a healthy spine, it is necessary for us to strengthen the gluteal muscles. This is where the hip thrust exercise comes in. It should be done in this way. We again slightly turn the waist, press it to the floor, strain the press and fix this position. Next, we try to place our feet in such a way that we can almost reach them with our hands, but just a bit further. That is, we should not put them too far or too close. The push will come from the heels. I'm lifting my toes to show I'm pushing with the heels, but you don't need to do this. Slowly tense the stomach a bit, maintaining a neutral spine here. Slowly, very slowly lift yourself up. Don't try to do this exercise with too much amplitude. It will be enough to lift it to an even position so we can get a straight line from the shoulder to the knee. And we squeeze the buttocks with all our might, slowly lower it, touch the floor with our buttocks and raise it again. Squeeze the buttocks at the top and release it again, touch and raise. As a progression variant, this exercise will be performed with hands raised to the floor. Again, we strain the abs, lift the buttocks, strain them, lower, touch and do in sets of 20, 30 as it turns out. There should be no more pain when performing this exercise. If this option seems too easy for you, you can make it more difficult by performing the exercise on one leg. Same old, same old. More control will be required here to avoid tilting your hips. Lift one leg up and start slowly pushing through your heel to raise your hips. Hold for 1 second at the top. Release, do it very slowly and smoothly. Lean back, don't relax completely, but rather lean back and then push yourself back up, hold a little and let down. You need to do 20 times on each leg per approach. 3 approaches in total were exercises of the intermediate stage, namely which should come after your calf muscle tightens. And on the magnetic resonance imaging, we saw a good, well-formed nodule. And after doing these exercises a few months with progression, that is, usually it takes somewhere 2 to 3 months, we should move on to a more complex stage where it's necessary to practice directly on training machines in the gym. Despite the fact that these exercises were specifically selected to be suitable for the maximum number of patients, I strongly recommend consulting with your treating physician before proceeding with them.